Hi, I'm Peter Hill, and this is the D-Word podcast, where we talk dementia. Thanks for joining me for another D-Word podcast. Topic of conversation on many people's lips over the past year has been the cost of living crisis. Every time you go to the shops, it seems that everything has gone up. There have been numerous studies about the effects on communities and individuals, but I've seen very little on what it has meant for people living with dementia. That's where this week's guest comes in. Clarissa Giebel has led a study on that very subject at the University of Liverpool.
I'm Clarissa Giebel. I'm a senior researcher at the University of Liverpool, and I work at something that's called the NIHR Applied Research Collaboration Northwest Coast. So all the work that I'm doing is really to bring together people living with dementia, carers, health and social care professionals to try and tackle these root issues of dementia care. And as you say, cost of living crisis has been one of the key problems. So I've been working with the Alzheimer's Society for a number of years now, and one of my contacts there approached me saying, we're doing this survey. We're wanting to understand a bit more. How is the cost of living crisis impacting people living with dementia? So I thought, that's fantastic. Let's try and do maybe a more in-depth analysis of all the fantastic data that you're collecting. So the Alzheimer's Society commissioned an organization to collect the data, and we've had over 1,000 responses, and that is all focusing on people living with dementia across the three nations, so England, Wales, and Northern Ireland, because Scotland has its own Alzheimer's Society. Yes, I hope I'm correct now. It was all about people living with dementia, but some people completed the survey on behalf of the person with dementia they knew. So that could be a family carer, it could be a friendly neighbor who's supporting someone, or a professional carer who knows a lot about the person with dementia. So what we found was, we know from our research, from reports from the society and other research, that people living with dementia and their family carers can often struggle a great deal to access care after diagnosis. It's usually you get the diagnosis and that you're dropped into the deep end. So we wanted to understand, how does it impact on someone with dementia accessing social care afterwards? Because people are already so hard hit in terms of finances and budget. And we found that about a third of the people were struggling to access and pay for social care. So that's daycare, support groups, respite care, paid home care in the community since the cost of living crisis, and particularly men and people from minority ethnic backgrounds across those three nations were struggling with accessing care.
That's interesting. Perhaps people from ethnic backgrounds, not so much of a surprise, but when the gender difference came out, that must have been a bit of a surprise.
Yeah, we did struggle trying to explain this. So we consulted with some of our carers who were advising us on research as well. We don't know exactly why. And what we did was we looked at whether there might be differences in terms of how women with dementia and men with dementia have general access to care. So are more women or are more men self-funding, or are more women or men getting funding from their local authority, etc.? There was no difference in terms of how the different genders were funding it. So all we can say is that it appeared that maybe men prioritized other aspects of their life more, men with dementia. So maybe really funding the basic necessities, food, rent, bills, etc. But again, we don't know. We need to do more research into that.
Yeah, and I guess, it opens up a whole new thing, doesn't it, in terms of research? Because I'm just thinking along terms of groups of people also living with dementia and thinking about young onset dementia, where obviously you've got a whole raft of other things to worry about.
No, definitely. And we've recently completed a study on finance management in dementia as well, where we interviewed people with dementia, young onset, late onset, and caregivers across the UK. And because we wanted to understand what's it like to manage your finances these days, particularly since the pandemic, where so many things have gone much more digitalized. So that was really interesting as well. And we found that some younger people with dementia felt actually comfortable with all the digitalization because they use the tap function on their card without having to remember, how do I count my money in the supermarket? Or you have standing orders or direct debits. That's really beneficial for some. But we also found that older people with dementia were struggling adjusting to the digital format of finances, but also that quite a few family carers just felt it a little bit of a unnecessary burden having to manage someone else's finances. And it's time consuming and there's no support really provided. So again, another demand on caregivers' time.
And another thing is, just thinking of my small town, is that now the absence of financial institutions to actually go and visit. We have no banks left at all, so we either have to travel or everything has to be done online.
Yeah, absolutely, and especially if someone has issues traveling as well. So there's all access issues there.
The station that makes you feel good. UK Health Radio. The station that makes you feel good.
You're in tune with the D-Word podcast, where this week's guest is Clarissa Giebel from the University of Liverpool. Now, inequalities, is a whole issue in itself, but you've kind of taken the great initiative of turning inequalities into a board game, which is the ultimate, well, I was going to say thinking outside the box, but in terms of the game, it's probably thinking inside the box. But how did all that come about?
Yeah, I'm going to pick it up. I mean, the listeners won't see me doing that now, but I'm going to pick it up. Because in the back on my shelf, here's the game. Oh. I'm quite excited about it. And yes, you're right, it's in a box, but it's quite out of the box thinking. So at Liverpool and before at universities where I was working, together with carers, people with dementia and care providers, we've done a lot of work on inequalities, quite overarching. So not just looking at ethnic background, your financial background, your age, your gender, where you live, etc., but really taking more of an overarching macro level approach, trying to pull all these things together. And us academics can write papers, we can write blogs, they might be read a bit more. But I personally feel that it doesn't have much impact. So for me, it's trying to really find solutions. It's not just trying to highlight that the issues. I really want to find those solutions with the people I work with. So we went to a conference last year and someone had a board game, I think, on care homes or incontinence or something related but unrelated. And we thought, well, why not do something on all the research that we're doing on inequalities? Nothing has been done. So we got some funds from the Wellcome Trust to host some workshops, co-production, with, again, people with lived experiences, health and social care providers in third sector, Alzheimer's Society, Lewy Body Society, etc. And we presented the work that we've done on inequalities to them, but we also wanted to hear from everyone, what are your experiences? How does that compare? How does it advance it? And then we gave everyone a blank sheet of paper, virtually or face-to-face at the workshops, and just ask, okay, so we now kind of think of all those barriers to accessing care, how would you put that into a game? The most common concept was kind of the snakes and ladder concept, in terms of when you come on something, you might move a few steps backward, move a few steps forward. And yeah, in the end, we came up with a Dementia Inequalities game, which will be available via the Lewy Body Society in September for World Alzheimer's Month as well. And it is for everyone, but we also want to particularly target health and social care professionals and care homes and home care staff, social care staff, and students to really learn and understand a bit more about dementia, because we hear a lot of the time, and we know from evidence that there's often seems to be a lack of knowledge and understanding of what dementia is. So we try to put that in a game to sit down, play it out, and learn about it.
And I think it's all about fostering people's interests, isn't it? Because I've seen a quote, which I think is great, which says, dementia is the opposite of fun, but it's the aim of our game is dementia. You know, almost two polar things opposite, you've brought them together.
Yeah, and you're right. One carer at one workshop was saying, but dementia isn't fun. And like, absolutely, you're right. It is not fun, but we're trying to make it as easily accessible and to create a learning environment about it. And to be fair, when we had the last workshop, there was no quiet person in the room. Everyone was chatting about it, sharing their experiences in a almost cathartic way, learning about things. So that was really nice to see.
Yeah, and I think you're absolutely right that, you know, research papers have their part, but sometimes I've got to admit from a lay perspective, they have big, long titles at the top, which tend to put people off. But if you kind of think slightly sideways and say, well, let's play a game about it, everybody's going to have their interest. You know, oh, wait a minute. That's as I did when I found out. You think, well, hey, that's interesting.
Yeah, no, we're really excited about it. And it's been lovely working with a team of 2 unpaid carers on this, and the Lewy Body Society as well. We've just been to the AAIC conference in Amsterdam last week, where we had a stall for the game, and there was some really good interest in this as well.
And I think it's so important, isn't it, to get unpaid carers, people living with dementia, involved in all these things, because people have said to me, "You've done nearly 200 shows here, you must be an expert." And I say, "Whoa, no way! The people that are the experts are the people that are living it." I can only imagine what it's like.
Yeah, no, I fully agree. To me, those are the experts, as I repeatedly say when we have meetings, because sometimes public involvement isn't considered as important as it should be in research. But for me, I can't do any research without it. I wouldn't know. I mean, I might know what the evidence says. Yes, there's a gap, but is it a meaningful gap? Should we investigate that gap? Well, I don't know. We need to speak to people. So yeah, you're right. We need those lived experts.
And you've put it all together, haven't you, for a few years now in Liverpool with the Dementia and Ageing and Research Forum, which I guess aims to do that, is get people together.
Yeah. I set it up in 2019 because when I joined Liverpool a few years ago, I noticed there are some really pockets of knowledge there, but nothing that brings the academics together with the lived expert, health and social care, and the charities, importantly, as well. So I set it up as a small meeting first, and then it kind of just grew from there. So we have webinars every 2 months. One is tomorrow. We've got an annual conference on the 25th of October in Liverpool, and tickets are available now. And we've got networking meetings. So we meet twice a year face-to-face, where service providers are sharing their insights. So again, it's not about academics, it's about learning about everything that's going on. So for me, it's probably the best part of the job, I must say.
Yeah, we'll certainly get behind those on social media and mention them on the show, because I think that's, that is so important, the message you're bringing across of getting everybody involved. I guess the big frustration, talking generally, is that we don't have a dementia strategy, do we? Because it was promised, but nothing ever occurred.
Yeah, I remember being last year at the annual Alzheimer's Society conference in London, and the then health secretary was rightfully harassed by a very well-known person living with dementia, and we all applauded her to say, well, what's happening? We're living with it now. There's so many of us living with it now. We can't wait for the cure, which will take ages. Well, he then promised something, but obviously a lot of government changes. So you're right, we don't have a dementia strategy in place at the moment. That's just on dementia. And I think the other issue is that we can do all the research, as researchers, we can do all the research, we can find recommendations, but what it boils down to is a lack of investment into social care. And particularly if we look at inequalities, many people don't have the personal means to fund certain services, accessing paid home care and getting support from your local council to access those services. Many people don't know they can. Many people struggle going through the system, and many people don't get the care they need, even when they went through the system. So we need much more investment into social care to kind of alleviate those pressures.
And I guess that investment is not only in provision of staff and provision of facilities. It's also in things like you've just mentioned. I mean, I once filled out a form for a blue badge for my mother-in-law, which I think was 35 pages or something like that, and kept on repeating myself every couple of seconds with the questions I was answering. It's that whole thing as well, and it's simple stuff that maybe doesn't cost so much money.
Yeah, absolutely. There's other forms that people are saying are, as you say, 40, 60 pages or something. But especially if we think of someone who has cognitive deficits, who might live on their own, as is increasingly common as people grow older now as well, how would you do that? How would you manage that? So the system needs to be simplified.
Yeah, most certainly. You hit upon the pandemic a little bit earlier in our conversation, and I know you're another person who's done some research on, the effect. Hopefully, we won't get another one, but the effects that had on care provision just during the pandemic.
Yeah, we led the first study in the UK, and I think we did a 5-country comparison as well on how the pandemic has impacted care in dementia. So we collected data literally from the start, probably week 2 or something of lockdown. And we found, obviously, unfortunately, that most of the social care services, so home care, daycare, respite, support groups, were closing down, except for home care, which was a little bit accessed still. And we found that the closures of this were linked to increased mental health problems, so levels of depression, levels of anxiety, poorer quality of life. But we also found that some people, so when we spoke to them, we don't have any quantitative data, but based on their accounts, that they were sending their relative with dementia to a care home much sooner than they anticipated because the symptoms had deteriorated so much. So all of the people we spoke to shared with us that their relative with dementia had decreased symptoms. And obviously we remember that care homes were the least desirable place to be. So for someone coming to that decision was really difficult as well. But following on from that, we did research purely focused on care homes and the safe care home visitation possibility, which really wasn't in place. That was late 2020, early 2021. And that caused so much emotional upset for family carers, but also for staff because they didn't have any guidance or training. And what was really upsetting for family carers was that they could see that staff was inside the care homes, but not often vaccinated. So again, there was a relationship breakdown between families and staff. So I think in terms of lessons, face-to-face care in a future pandemic should really be facilitated as much as possible within safety measures, because we know from the Netherlands, from May 2020, they implemented guidance on safe care home visitation. So it was much easier accessible. So yeah, hopefully it won't be repeated, but there will be another pandemic at some point. So we should learn those lessons.
UK Health Radio, the station that makes you feel good. UK Health Radio, the station that makes you feel good.
This is the D-Word podcast, where I'm chatting to Clarissa Giebel from the University of Liverpool. You were talking about the Netherlands and you know, your links with the rest of the world, as it were, in dementia care. I mean, what are some of the learnings that, you know, that we can take here in the UK from what's happening elsewhere?
So we completed a study during the early stages of the pandemic. It was funded by the Alzheimer's Society, and I looked at barriers and facilitators to dementia care between England and the Netherlands. There were very similar barriers between both countries in terms of lack of knowledge, money, where you're from, your background, transport, etc., where you live, and if you have a rarer subtype of dementia. But the one thing that stood out in the Netherlands was that people on the whole, not everyone, had a link worker after a diagnosis, something that people in England and across the UK repeatedly ask for, but often don't get. So it's a dementia care navigator who is not medically trained, but someone with understanding from a third sector background or social work, etc., is empathetic and can really link and liaise with someone with dementia and the family from the point of diagnosis and be that single point of call. So if you have a question about how do I manage my mum's finances, you can call that person. How can she access a daycare centre? How can I access some support? That person will navigate you. So within the group that I'm leading, we're trying to build on that and really pull out those facilitators a bit more and try and adapt them to the UK context. Now, we know there are care navigators across patches of England, including Mercycare, Newcastle, etc., Warrington, but there doesn't seem to be a wider awareness of it or evaluation. So what we need to do as researchers is we need to kind of evaluate this more and try and get this implemented across the country. And other learnings globally, I work with Australia as well. It's very different there how dementia finances are managed. So when someone gets a diagnosis, apparently people get a budget that they have to manage themselves, which is interesting. And I also work with Colombia a lot on a project on mental health for older people, carers and people with dementia. There is no dementia awareness in Colombia. There's no strategy. People don't know what it is, and family carers really struggle with the concept and how they can give any sort of support. So for me, it's really interesting to learn just how little dementia knowledge, support, and community support there is in many lower and middle income countries as well.
Yeah, we've got a good friend of the show in Brazil, and I think the story is fairly fairly similar there. I mean, it's interesting to learn, all these things. And when you talked about the dementia navigators, I think it's one of the major things here that post-diagnostic support seems to be a real postcode lottery. And the fact it depends where you live as to what you get. And the concept of having someone to kind of negotiate through all that, because, carers have got enough on their hands without having to do, loads and loads of internet searches and phone lots of numbers up. And to have someone to do that would surely help in not only make it easier for the carer, but, what we're aiming at here is letting people live in their own homes for longer, I guess.
Absolutely. And it would also... we hypothesize that having someone like that, a care navigator, would reduce unnecessary healthcare expenditure. So if the carers are well looked after, they don't have to go and see their GP for difficulties, healthcare and mental health problems. Similarly to the person living with dementia, they're better supported. So as you're right, it should be an easy way to support people better.
As a researcher, I mean, is it frustrating to try and get these messages out to the media, or, is it easy or difficult, or, what's the kind of story there?
I think as a researcher, it's fine to get it out there. And I think social media is helping a lot as well. It can provide us with an outlet. And I absolutely love working with our carers, people with dementia, and the charities, because they're so passionate about it. So they shout out about it as well. They go back to their communities or nationally and then really make a voice and make a noise for it. What I find frustrating is that as a researcher within the social care area, that social care often seems to be neglected as a concept. So how we do write policy briefings. I've written a few on our COVID research with the Liverpool Heseltine Institute, but there's only so much that a policy briefing or a blog or a talk or a video can do. So it is difficult to find that link in between research and actual change. Yes.
Do you think social care is too big an umbrella in the fact that, for the normal a person in the street, you say social care, and I may think of so many different things?
I suppose whenever I do talk about social care, that's why within my field of dementia, I then say, well, it's if you go to a daycare centre or if you have someone supporting you in your own home, that's not a healthcare. You don't need health support. You're physically well. You just maybe need someone to help you with your medication or getting dressed, etc. So, yeah, but maybe generally social care isn't that well understood or prioritised.
And it's kind of, there's obviously great links with medical professionals, medical researchers. In terms of social care research and medical research, I guess that the two do dovetail together. Researchers all talk to each other.
Yes, certainly. But so something I suppose that's sometimes lacking is to show if we invest in social care, it will reduce expenditure of healthcare, which is what the NHS and the funders are, and the government are all after. We want to reduce the pressures on the NHS. So, but yes, of course, I work a lot with GPs because obviously they make the diagnosis, with clinical psychologists as well, and with memory clinics. So we have that link with the healthcare sector.
And I guess, to bring our discussion to a bit of a conclusion, what it seems to me is that there are a lot of things going on in little pockets all over, and it needs something overarching over the top. And I guess it goes back to what we were saying about dementia strategy to grab it all together.
Yeah, dementia strategy can help. So last year, the NIHR, so National Institute for Health and Care Research, had a priority call on dementia, for example. So sometimes you find priority areas to really encourage more work going on. But yes, there needs to be more overarching awareness. And I do think that charities are so important. So I'm from Germany originally. I came here to study and ended up working here. But in Germany, we don't have as much charity representation. There is some, but England and the UK is overwhelming with that, and it's fantastic to see. So I think they are a key driver in making any changes alongside us researchers and anyone else.
Yeah, very, very important. And, we try and raise a profile on the show here with a number of really excellent UK charities. One thing I must congratulate you on before we go is your charity work with the London Marathon that you completed. How was that?
Yeah, it was good. Very rainy. I'm going to do Chicago for the Lewy Body Society as well in 2.5 months. So 2 marathons for the Lewy Body Society this year.
Well, best of luck with that, Clarissa. We'll follow your progress with interest. And thank you so much for being my guest here on the D Word.
Thank you for inviting me.
Thanks to Clarissa, and I hope the forthcoming conference goes well and she enjoys the Chicago Marathon. And if you want to follow her progress, then Twitter is the best way, at Clarissa Giebel. Well, that's it for another D-Word podcast. Thanks for joining me, and I hope you'll join me again soon for more Dementia Talk.